So welcome. It is a great pleasure for me to be able to introduce tonight's speaker, Beverly Burns. I think the most important thing I could say about her is what a patient told me a number of years ago when she came out of a treatment room, and she said, you know, Beverly could read me the want ads and I would still feel healed. She is really, really a remarkable practitioner, person, teacher. Beverly is the person that I asked to give a lecture to the second-year medical students. It's the one time we have an option to introduce the concepts of integrative, alternative, and complementary medicine to all of the medical students. But more importantly, I think she embodies the spirit of what traditional Chinese medicine has to offer. She got her license, became licensed as an acupuncturist in the state of California in 1991 and has done remarkable work in particularly treating women with breast cancer. It's a specialty that she has. So she now is as much full-time as we can get her at the Osher Center. But many of you may be aware she single-handedly started the Charlotte Maxwell Center Clinic in the East Bay, and now with a branch in San Francisco that offers these services for women who don't have the capacity to pay for this, who have cancer. So I'm not going to spend any more of your valuable time. Tonight's going to be a very interactive session. So welcome, Beverly.
So thank you all. I know that you guys have gotten a chance to know Ellen, and it's always a real pleasure and honor for me to get the opportunity to work with her. So I'm very pleased to be here. So what I wanted to say is we have time tonight for this to be interactive, and I think it would be much more enjoyable for all of us if it is. And so that's beyond the piece of having a demonstration, of including some acupuncture and a number of other things, but also for you to stop and interrupt if you have a question, because some of this language is very different than what you might have been exposed to. So please don't hesitate to interrupt, ask a question. And I want to start with a question just of how many of you have ever tried using acupuncture? So quite a few people. And how many of you have ever taken any form of herbs? Really high too. So that's not always quite as high with the herbs. And you know, it's a broad spectrum in terms of using herbs. So what I hope to do tonight is to be able to give you an introduction and overview of what traditional Chinese medicine is. Some of the things, a very limited amount of the things that we know about it in terms of some of the studies that have been done in Western or conventional type of medicine. What I think is interesting for me is people very often ask me, what am I doing? How is this working? And I find it's sometimes easier to say small, simple little boxes about what we know in terms of how the Western physiology works than to give this broad overview of here's how I'm giving you a diagnosis in terms of Chinese medicine, because it's such a foreign language. So if we can do some introduction of what that information is and really try and think about how you might be open to it in a different way in your healthcare process in terms of incorporating it in your life. So here we go. So Chinese medicine is a comprehensive system of medicine, and what's important about that is that it means that there's a way to diagnose someone and then plan a treatment plan, and it includes many different things. And so we're going to talk about all of the different things that it includes throughout the day. But I think most often what happens is people think of acupuncture first when they think of Chinese medicine, and I want this to be a little bit broader than that. So when we think of health, many people in general, I am teaching a course, a graduate course in the acupuncture college right now, and we really tried to talk about how do we define health differently possibly than in other systems of medicine, and often health might be defined as the absence of disease, but what we would like to try and broaden that to is say health is a homeostasis, right, where you really feel very well in your body. And we might then define that further and say it's a balance of energies. So most of you probably have seen this figure before, right? The yin and the yang. And it's not about everything being equal in terms of energy in your body, but it's about how they coordinate together and how they then complement each other, because everybody might have a different balance. It's about what is the appropriate balance for one person. Then we also have these other terms that are really different. So already we're starting with the yin and the yang. And if I said to you, a woman is more, fill in the blank of those two words, what would it be? Right, see, so everybody already knows that piece, yin, and a man tends to have more yang energy. And included in that is that the nighttime is more yin, the daytime is more yang. So these are all about balances and how they blend together. So if we go farther, we say that there's an energy in the body called qi. Well, there are many, many different kinds of qis that we define. And what you just need to know is that that's something that might be the additional component that brings life, that we try and follow how productive that is in terms of maintaining somebody's health. And so when we don't have a balance of the yin and the yang, it usually means there's not enough of something or that something's blocked. So when something is blocked, that can be defined as stagnation. So I'll show you a really lovely picture later on of the meridians, and then we can look at some of those on the body when we do needling. But this energy flows through channels on the body. If it's not flowing evenly, then we might have some blockage or we might have some deficiency. So early in this medicine, really prevention of disease was much more what was emphasized. And if you have a community physician, similarly if you have a community primary care physician, their goal is developing a relationship, knowing who you are. This is similar for family care or primary care. Really, it's about them knowing the quality of your health so that they can then help you determine when something is off. And I think that that's one of the pitfalls that we currently have in our healthcare system here, is that we don't get enough access to our real primary care physicians in conventional medicine. And it's the same thing that's true in terms of traditional Chinese medicine. Most often people don't come until there's something already wrong. If we could try and work in the beginning when there's an imbalance before something is really seriously wrong, we might have a better capacity to prevent a more serious illness. That's true in both systems of medicine. That would be a goal. So this is something I think that there's a tremendous amount of pride in the Chinese medicine community, that this is an empirical form of medicine, meaning that we have books that date back a couple of thousands of years ago. And so it has really built on the information gathered over time. I want to tell you that those books were fairly different from how we talk about the medicine now. There was a tremendous amount of spiritual explanation and also of trying to eliminate demons from the system. And so it took a while to develop as looking at the whole person and trying to treat people in a more comprehensive way. The way of teaching in China still today is often very question and answering. So much of the early textbooks are almost an interview with a physician. So it would be similar to Socrates and Aristotle, that their students are asking them questions and that we then try and find answers in the teacher's response. So over this very long period of time, a rich development of this system of medicine has happened, where we diagnose many different things. So the early needles obviously weren't stainless steel needles. If you lived by the beach, they might have been a fish bone, a very thin fish bone. If you lived internally or in a wooded area, they have documentation of using porcupine quills. So obviously your goal would be to use fewer needles if you use porcupine quills, since they're a little bit thicker than what we would use now. So many things had to develop. There's a wide materia medica of herbs. That certainly wouldn't have been true 2,000 years ago. You would have used the herbs in your neighborhood just like any other traditional or native group of people would do. One of the points that I think is most important to make, and that I think is a very important take-home, is that if you have a diagnosis in conventional or Western medicine, that diagnosis does not necessarily match anything to do with Chinese medicine. And what I mean by that, as Ellen said, I work with people with cancer very often, and so you can have a diagnosis of breast cancer, but you can have 10 different diagnoses in Chinese medicine when you have that breast cancer. So you would treat that person individually. And that's important to this medicine and often makes it very difficult to try and evaluate, because then if you're looking at women with breast cancer and seeing if the Chinese medicine is helpful for one kind of symptom, you might be treating each of those women differently, and so it's very hard to compare them. So does that make sense? Yeah. Does anybody have any questions so far? So one of my tremendous hesitancies that happens for many people is they sometimes go to a class and they come home and they're told that they had liver qi stagnation or kidney yin deficiency, and they're terribly afraid then that something is biomedically wrong with their kidneys or liver. And that's not what it means at all. And so you could have liver qi stagnation and everything be appropriate with all of your liver enzymes and your liver function and no cirrhosis. It means that you have an energy that's blocked. So one of the diagnoses for breast cancer is liver qi stagnation, but in this country, not surprising to me, is that many of the imbalances that occur, particularly for younger women with breast cancer, are from overexertion. So we have a culture that doesn't sleep enough, that works too hard, that thinks it's appropriate to work many, many hours in a week. And so many of the imbalances are more of a deficiency. So blood deficiency, kidney yin deficiency, heart yin deficiency. So really different ways to look at this imbalance. And you can still come out, you can have heart yin deficiency and kidney yin deficiency, still have a stage 2 breast cancer that's estrogen receptor positive, that looks exactly the same in the laboratory, but how you present as a person is different. So it is a different imbalance. So the tools of this, you've already seen a piece of this, but remembering that not just acupuncture is Chinese medicine, but acupuncture and moxibustion, of which I think I have some here and I'll show you. What's moxibustion? Chinese herbal therapy, therapeutic exercise, and dietary recommendations. So first of all, I want to just right off the bat say, yes, absolutely, everybody should be using disposable needles now. It is the law in the state of California to use disposable needles. So, it's not an uncommon question. Moxibustion is compressed mugwort. And the most common way it's used now is in a stick, and you hold it over someone's skin and burn it. And mugwort is a very resiny plant, meaning it's oily. Just like if we all went out and harvested marijuana and we touched a lot of it with our hands, we could test positive for that. Mugwort is the same thing in that oil or resin can go through your skin. So you both warm the local area, but you additionally get the oil of the resin of the herb into the skin. And it's something that you use a lot for someone who their situation is weakened or diminished. So for instance, during chemotherapy, moxibustion would be very commonly used. It would be a very good thing to use during chemotherapy. Then Chinese herbal therapy, and we'll talk more about that, and I brought a variety of herbs for you to look at, is a very big component of using treatment in this form of medicine. And one of the things that I think is difficult but true is that acupuncture in this culture is very hard to do in the traditional way that it was done. And what I mean by that is you would often do it frequently in a week. And both financially and logistically, that's very difficult for most of us to do. For you to go to any appointment of anything 3 times a week would be really hard with work and your family and your life and whatever else that you do. And so herbs are something that we can do in a more traditional way, meaning there's something you can take every day if that's the prescribed way to take them. So it's a big part of my practice. I use herbs quite a bit. Therapeutic exercise incorporates more than one thing. So Tai Chi is a therapeutic exercise in Chinese medicine, as well as Qigong. And both of those are really important forms of physical therapy, basically, in Chinese medicine. And one of the things that I say for someone whose health is fairly balanced, maybe they're post-chemotherapy and radiation, or there's someone who hasn't ever experienced a diagnosis of cancer, if I would recommend doing anything, if you were picking one and you were going to achieve balance and you were trying to do something on a regular basis, I would say do Tai Chi every day, because it's something that you can do daily. It is a very good promoter of health, balance, strengthening. It's good for your brain. There are many positive benefits to it, and it's harder to long-term incorporate these other things into your life. And I think it's a similar thing to say, if yoga is the pursuit that you would like to follow, for you to do that on a daily basis is a way to create a routine in your life that's really positive for your self-health and for your lifestyle change. But both of those are things that you would recommend. And I, for instance, sometimes recommend Qigong, which is a breathing exercise that's much more subtle in movement than Tai Chi, and have people do really simple breathing exercises based on some symptoms they might be experiencing at the current time, or some imbalance that they have that they want to try and address. And the last piece is dietary recommendations. And have any of you ever tried to follow dietary recommendations from somebody who practices Chinese medicine? So a little bit smaller group, two people, I think. And you know, we have in the Bay Area, I think, almost a distorted view about eating. And what I mean by that is a positive thing. People eat so much better here on average in the immediate vicinity of, you know, San Francisco, Oakland, Berkeley, the South Bay, Marin, that it's not a great comparison to a neighborhood where there might be a lot of fast food restaurants and people are regularly eating Burger King and McDonald's with a high degree of frequency. So we already have a pretty good idea, at least about what is good food, even if we're not always doing that. But it's a very different model in Chinese medicine in that you wouldn't recommend the same thing from one person to the next. I left somebody who I was working with yesterday who's just finishing chemotherapy, but she's had something she's dealt with a long time around digestion, and she said to me that she would like to start a support group for women who have dampness, because she has dampness, and it's an imbalance that's difficult to address, and it really impacts your digestion. And she was kidding about it, but her point was that you have to eat differently in this situation. And you can oversimplify this and just say, if somebody has an energy or an imbalance that's very hot, obviously you wouldn't want them to eat hot foods. And if somebody's very cold, you wouldn't want them to eat cold foods. But the most difficult piece of this, I think, for people in the Western cultures is that cold foods are raw foods too. So we think of very healthy foods as being salads, and that's a raw food. So in an area that's not really that warm, like the Bay Area, to regularly have salads be your most healthy food is not necessarily the best thing for your digestion. So it's something that we would ask you maybe to adapt based on how your imbalance is or you present. Now, I'm not ever an absolute person about anything. I would never say, don't ever have sugar, don't ever have caffeine, don't ever drink, because I think that if you encourage people to do absolutes, it's often a kind of a setup for their own personal disappointment. I wouldn't care if they did that. I think that they tend to then be disappointed. You know, if 80% of the time you have a healthy diet, then you have a spectacular diet if you're also exercising and trying to sleep. So kind of having reasonable goals around that. And then working with somebody who can help you evaluate as you go along the way. So if somebody is, again, not in active treatment, I often have them keep a food diary and a symptom diary and see if we can see, are there any things that overlap where they might not feel as well one day, and that might correlate with a regular food intake that they have that might not be just right for their body. And that's much easier to do than do a lot of allergy testing or kind of the newer advanced blood testing that is food reactivity that I'm not really sure if I know how accurate those things are. I'd rather see if watching habit and diet reflects that. So when we try and then look at someone, we do a very similar thing to what your primary care physician would do. They would ask you to come in and do a full physical. For those of you who don't know this, this is one of the most important pieces taught in medical school, and Ellen teaches it very often to the students, and that's how to do a physical exam when somebody comes in. Well, we have a physical exam, It just has some different questions and certainly different ways to palpate. So we look at you, we look at your tongue, and we're going to look at pictures of tongues in a minute. The spirit or the energy of the life force is reflected in the eyes, and so you want to see that. You listen to the tone of how someone talks and how strong their voice is. If you've ever known someone who's very sick, you know that they have a hard time sometimes being able to vocalize or really speak loudly enough. The quality and the strength of the voice, and then smelling, and so that's often, you know, people kind of react to that a little bit. And I want to say that for a long time, you know, we didn't have these wide-ranging ways to look at different kinds of coughs like we do now in a laboratory. And we found indications that might have been really important in terms of saying this person is very ill. And so smelling was an important and still could continue to be an important way to diagnose someone. And then asking the traditional questions, and this is what I had said is similar to what your primary care physician would do, basically going head to toe. Do you have headaches? How's your eyesight? How's your digestion? You know, kind of all the way along, up and down your body and all of the systems of your body. Remembering that if then somebody mentions something more than once, you're going to emphasize that. And then the last piece is palpation, or touching someone, and both taking their pulses, and again, we're going to look at how to do this. And then there are many diagnosticians that palpate the abdomen of the body or other pulses on the body, but that's a little bit less common today. So this is one of the pieces that Ellen just mentioned in terms of how different the language is, that these are the important components in the body that indicate balance and health, and that we need them in order to have both life, but definitely good health. And the only thing that I'll point out that's important is that blood as a concept in Chinese medicine is more than red blood cells and white blood cells. So when someone says to you that we need to nourish your blood, that also means we hope to help your blood system, but that we need to do all of the things that nourish. And so these words are used when you try and explain what you're doing, but they're not as easily understood because conceptually dampness, like I had mentioned earlier, is a bigger concept and not one that we're very familiar with. We're familiar with dampness outside in terms of rain, and even dampness maybe in terms of phlegm and a cough. But dampness in this concept means both a cough and digestive upset, and very many different things can be because of dampness in the body. So then the organs of the body are translated very similar to the organs that we have in terms of the Western physiology that we know, but what's most important in terms of Chinese medicine diagnoses is the function. So while the spleen holds the blood, just like it holds blood in Western physiology, the spleen in Chinese medicine is responsible for digestion. So the importance of identifying that is just to know that someone might indicate something to you and it doesn't necessarily make a lot of sense in terms of conventional translation. Just that these are paired organs, they work together, they balance each other. We definitely would say that if one of these organs is imbalanced, that it would impact another organ. And so how they interact and engage is really important for your health. So the causes of disease are also very similar. And so one of the ways that I think that it's important to compare are that if we start first just with the constitutional imbalance of coming into the world, today we now study many things that are constitutional imbalances. And what do we call those in conventional medicine? Yeah, say that again, Daya. Yeah, so genetic imbalances we know cause diseases. Well, there's a long theory that people come into the world with an imbalance in their system, and that's the weak link, or the place that you have to be more careful in terms of protecting your health. Lifestyle factors are obviously something we currently identify in terms of self-care, benefiting health, both exercise, diet, all of those things. Sexual activity is something that's very often identified in traditional texts, and we don't necessarily have to go into that in detail, but frequency was a really important component according to traditional texts. And then 7 emotions, stress obviously is something that contributes to your system being more susceptible. So alone, I think that it's very difficult to say emotions are a cause of a disease, but I think that that stress can very much contribute to your susceptibility. And the pernicious influences, I think, is an area that is most important in terms of comparison, because we might have called this wind, cold, heat, damp, but now we know that there are viruses and bacteria or external influences that influence health in many ways. And until really very recent history, the past 150 years, most people died from these kinds of things because we didn't know how to adapt and address issues of dehydration related to somebody having an intestinal bacteria, right? It couldn't be resolved. And so that was what many, many people died from, and these were early identified as being the things that could cause serious illness and be life-threatening for people. Now, I always make sure to point out that I include in that, in terms of external influences, environmental factors. Since we've changed the world so much in the past 75 years, we don't quite grasp how synergistically there are so many components that might work together to influence our health along with all of these other things. And so I think that those are certainly pernicious influences too in terms of health. So now we're going to look at the tongue, and now you guys are going to look at each other's tongue. And I'm going to try and bring a few people up front first for us to look at a couple of tongues. So I'm not really sure if you can see this, but what I want you to see first is, the organs go to different areas of the tongue, but you're looking at the body, so the shape of the tongue, the color of the tongue, the coat of the tongue, and then if there are some irregularities in one area, you would then identify that as being an imbalance of that organ. So let's see if you stick out your tongue here. Can people see it? Yeah, pretty good, right? Can you see almost in the back? Okay. Now on the sides of her tongue, what do you see? Scallops, right? So, and then the coat is a little bit thicker than you would want that coat to be, right? So both of those things go together. A scalloped tongue and a little bit thicker coat are both related to spleen qi deficiency. So the spleen is responsible for digestion, and it would be about trying to strengthen her digestion. And it's probably because she worries so much, because she also works with people who are really ill, and she's probably trying to take care of them too much. So is there anybody else who would be willing to come up here in front of the class and do this? Come on. Okay. Go ahead and stick it out that way. No, but so not as thick a coat, but a little similar, right, in terms of that the sides are slightly scalloped. But if you look at the sides a little more closely, they might be a little more red than the rest of the body of the tongue. One more time, stick it out. Right? See, so you can see that it's has some similarity to the previous tongue that you saw, but the emphasis would be more on the sides of the tongue, right, so on the liver, than on the spleen. So not, what's really great for me in these classes are that people are generally pretty healthy. So we don't see anything that's like, oh no. And we really pretty much see tongues that show very little imbalance. And so that's great.
What does the liver mean?
So the liver moves all energy, or moves all of the qi. And anytime you have any energy that's blocked, it's responsible for that. And the liver and spleen in balance are very important for women in terms of menstrual history and menstrual cycle. And like I said, like that tongue doesn't really reflect too much of anything going on, so I wouldn't emphasize it too much. So what I'd like for you guys to do is just find one person next to you and both look at each other's tongues. And I'm going to come up and down the rows. One of the questions asked in the back when we first started was, does the ability to curl your tongue have anything to do with Chinese medicine? And I want to say, no, not in our text, but apparently there might be some genetic link to sense of direction in curling your tongue. And there's been 2 studies done about this. And the reason I know this is I can't curl my tongue. And everybody at my house is very clear they should never take directions from me to get anywhere. I just even said when I went to the bathroom, I had a hard time getting back in here. Sure. So what you asked is, it seems like this is very simple. And so why wouldn't our primary care doctors say, after you come in and say, I haven't felt well for a couple of weeks, and they would say, let me look at your tongue. And so I want to tell you that we have textbooks of hundreds and hundreds of pages of tongues. And it really is a refined art. So that's one piece. It also doesn't fit into the diagnostic system of conventional medicine. But with that said, there are times that your primary care might do that. If you have strep throat, they're not just looking at the back of your throat. They look at your tongue. If you have thrush, which is not uncommon for people who are undergoing chemotherapy or have an immune dysfunction, people often get thrush in their mouth. That's how diagnosis often occurs, is by looking at that. It's just the refinement of kind of what's the tip mean, what's the coat here mean, is really specialized according to this diagnostic system. And if you ask dentists, for instance, many of them will say anything that you have wrong with your tongue is congenital. A congenital geographic tongue, a congenital scallop tongue, because they see somebody and over the years see it as being the same, and we think that it can change, and certainly have seen people's tongues get better and sometimes worse. And so when I said kind of up and down the row when I was running up just a little bit, most of you guys have great tongues. So most things, believe it or not, don't directly reflect immediately on the tongue. I mean, obviously sucking hard candy or a cough drop will really show. And drinking coffee very nicely adheres to the coat of your tongue. And so coffee is pretty reflected. But unless it's scalding hot tea or freezing ice cold, it wouldn't really change the coat very much. And it wouldn't change the texture of the tongue at all at that time. And so what I was saying is most of you guys have great tongues. So, you know, just to differentiate, this tongue is pale, right? While this one's a little bit too red. And it's more red at the tip. So you'd easily be able to identify that. This tongue has a thicker coat. I have to tell you, the best question that was asked is that apparently different areas of the tongue when you're wine tasting reflect different qualities of wine. And I don't yet know anything that correlates it like that in Chinese medicine, but I'm certainly going to find out, because I said I'm interested in tongues and I like wine, so I'm going to see what I can find out about that. But this is a little bit thicker. And then here you would see a fairly deep center crack, and that can mean something to do with potentially an ulcer or thirst, or very simple things. So those are right. Well, an ulcer is a pretty simple. Yeah, go ahead. So the scalloping means qi deficiency, and you see right here. Right, little scallops. So people often will say to me, this means my tongue is too big for my mouth. No, it doesn't mean that. Because they think that their tongue is spread out there. And so that means a qi deficiency, and usually a spleen qi deficiency, so a digestive deficiency. So this is very pale and a little bit wet. So blood deficiency with some dampness. Probably the dampness developed because of the blood deficiency in this situation. So this is obviously very red and a little bit hot, and so it could most potentially be yin deficiency because of how the tongue is pointed like that. So I'll do a kind of brief, the best example of yin deficiency, but that's what that means. And then the coat really here is a little bit thick, so it's yin deficiency again with a little bit of dampness. And so if this is the yin and the yang again, we're talking about balance. The picture that I want you to see in terms of difference is, if this is yang and it is too much, or yang excess, that picture is of too much heat and too much energy. So here's somebody who might be drink a lot, have high blood pressure, easily angered, red face, and you would want to clear that heat, right? So that's yang excess. And then if you have not quite enough yin, that still looks hot, but how that looks is night sweats, palpitations, anxiety. Who is that a picture of most often? See? Menopausal woman. So the goal there is not to clear heat, but to nourish the yin. So in this situation, there would be maybe a little bit of real heat, but mostly you would be trying to nourish the yin. And so that could commonly be a tongue for a woman who's having terrible insomnia during menopause. Yes, I have the perfect example in the reverse direction in that when I was in school, I had what was called an unremarkable tongue, meaning everything was correct with it, and now I don't. And so that's a reflection of like, have I taken enough care of the balance in my life? And so it can go both directions. And you definitely, when somebody has a more serious illness, the nuances are important and are very big indicators of problems that might occur. So, you know, and then just as a comparison, not so much for us to go into what these imbalances are, but you can see that these might be more serious developments. They might take longer for this to occur in somebody's system, right? Because they're a little more difficult to resolve these issues at this point. They all have more than one thing going on in terms of some, like at the top, furthest top one, it's slightly deviated, it has a crack, it has a different coat, you know, thick coats on many of them, or no coat at all with a lot of texture. So all of these things indicate very many different, more serious imbalances. And so far I haven't seen one of these tongues here tonight. The crack down the center of the tongue doesn't always mean the same thing. No, it doesn't. It can mean something to do with digestion of the stomach, and that's why I said it can mean an ulcer, but it also can very often be related to a very emotional, spiritual impact at some point in your life. So one of the things when Ellen was saying that I worked with the medical students, they also have a program for the fourth-year students that's an elective, and we all do diagnosis on each other. And it's almost kind of boring because they all have the same tongue. They all have the student tongue where they don't get enough sleep. So the tip of their tongue is much more red, and it's also an indication of stress. So they're all like, oh, same tongue, same tongue. So we're always happy when somebody has something going on so we can see some variation on the theme. So you will often, depending on what people's lifestyles are, you know, see how things correlate. Sure, absolutely it does, just like our health changes with age. And so we might take better care of ourselves as we age, or we might have gradual decline. And I'm sorry to say that it's more commonly true that we, you know, have accumulated different things over the course of our life because it's hard for most of us to take very good care of ourselves. So absolutely, over time your tongue changes, but it can go in both directions. It can get better and be more imbalanced. But they don't consistently change the same, meaning that everybody as they get older doesn't have the same appearance of a tongue. So on this tongue here, in the back, the bumps are a little bit larger. So first of all, your taste buds are larger at this point in your tongue, and this coat is much thicker here. So one of the things that's happening in this situation is that the thickness of the coat is accentuating the taste buds that are there. The other part of this is the lower part of your body, or lower jowl. So it can indicate a urinary tract infection or enlarged prostate. There could be a couple of different things, but obviously the texture of your tongue is different there. So how red bumps would be reflected there are also true just because of the texture of your tongue. So the other piece that we do is we do the pulse. This again is something that is a very important diagnostic tool. And one of the things that I always say to the students that follow me when I have acupuncture students follow me is that it's important to remember that in China it's much less likely to have the conversation that we have here with the depth and amount of time, partially because that's not how a practice is often able to be run. They're very busy and might see a large number of people in a day. And culturally, they might have a different form of communication in terms of how much you're expressing and exposing about health. And there might be a little less privacy in the medical setting that you're in. Pulse taking is much more refined in China than it is here because we do much more investigation verbally. But this is the ultimate art form of diagnosis. Using pulse taking in conjunction with tongue evaluation should enable you to get a comprehensive diagnosis just in and of itself. Now, most people don't do that, but it is what you would be able to do. And so you just take 3 of your fingers along the radial pulse. So you wouldn't do it like this. You would take, your opposite hand and come around, and on the crease, like the second crease would be where you would put your index finger and just put those 3 fingers there. And these represent different positions. But first let me say, what I would ask you to do is press down and then slowly release the pressure to determine how deep or superficial it is, how relatively rapid or slow it is, meaning not exactly how many beats per minute, but in comparison, is this a slightly rapid pulse, a very rapid pulse, a slow pulse? And the traditional way to evaluate that was the number of beats of a pulse per breath of the practitioner, because the assumption was the practitioner was in good physical shape. And so so now we should probably count it more frequently just to have an exact number. And then the quality, and the quality is a very elaborate evaluation. There are terminology like slippery, wiry, thin, thready. And again, this is something that in conventional medicine you will hear sometimes of a thready pulse when someone has had a stroke or they're dehydrated. They might have a thready and rapid pulse. But in Chinese medicine, it's very important to look at these qualities in a deep and significant way, and then also compare the organs. So on your right hand, you have first your lung, then your spleen, and this is the simplest. There are really many more positions there, but this is the simplest way to do this. And then your kidney yang, and then on your left side, your heart, liver, and kidney yin. Now you can also say that with the heart goes the small intestine. You might say that one of the kidney pulses is an organ that we have called the sanjiao or triple burner. And so there are many different positions, but what I think is most important when you're first practicing this medicine is to know, is something weak or strong, fast or slow, superficial or deep, and then at least you can tell if somebody has a deficient or an excessive condition. And then further develop that information based on the questions that you ask and the more that you learn about pulse taking. So again, we can do a little bit of that when we do the demonstration. Yes? Lung, spleen, kidney yang. Right, so even though the right side is yin, the kidney yang pulse is on the right. Yeah. They're reversed in terms of where they are on the pulse. And that's one of many ways. There are also different levels. So here are the channels and meridians. You see all of these different points here. I think it's very unusual for a practitioner to use on a regular basis more than 50 different points, and really it's more likely to be about 30 different points. So even though there are 400 different points on the body, it's not as if every practitioner regularly chooses all of those different points. So you might use some points on the front of the body, on the torso and on the back, but the points that are most distal, hands and feet, head, are the most important and strongest points. And you can see obviously that the meridians, many of them are very long and they connect and are interplay with each other in a really important way. And I try not to use a lot of needles during a treatment. On average, I would almost always use less than 10 needles. Some people use many more needles. It just depends on how you practice the medicine. Is there an anatomical or physical correspondence with the meridians? Not direct. Many nerve pathways obviously run along a meridian, and for instance, often meridians run between major muscles. But that's not the exclusive meridian. So it might run on your leg between a major muscle and then follow a different nerve path somewhere else, or similarly on the rib cage, there are different channels that run. And so they're not exactly following those same pathways. But you use anatomical locations, 4-point location. You use measurement with the hands as well as different bones and creases to identify where points are. So there are 12 meridians, and those are associated with the organs that we've already talked about. Really, there are closer to 400 points when we use extra points. And this is the part where I said it's often easier for me to say to somebody, they'll say, well, what are you doing and why are you doing it? And I can say, well, we do now know that when you use acupuncture, it can sometimes change the neurotransmitters and do things like increase endorphins and influence different levels of chemicals in your body. And that can continue to be true even after you take the needle out. You know, it won't necessarily last 3 months, but it can continue to be true. But really, when you're making the decision about what points to use, you're making that decision based on what the imbalance is in Chinese medicine ultimately. That's how you should be making that decision. It's nice that they then correlate, and we've found that they are able to influence the body in different ways. And this is an important point. Different styles exist. I do not come from the school that believes that you must endure when you have acupuncture, meaning I don't think it has to be excruciatingly painful for it to be effective. I have had clients come to me and say, oh, I've gone to somebody who said you really, really have to feel it like at this level. And I think there are different ways to use points. And I also think that, again, culturally, it's not the model that fits for us to have very strong needling with a lot of points for people. So, but just I think it's important to know that in the state of California, there is a fairly good educational system, and it requires more hours than most of the other states, and that Northern California alone has more acupuncturists than the whole rest of the country combined. Now a lot of reasons for that, both in terms of the practitioners and in terms of the users. But California by far has more, but Northern California alone has more. And then there are physicians who practice medical acupuncture, and there's training that's called medical acupuncture, but which is based a little more on using a Western physiological model. But many of the physicians that I know that practice acupuncture also have studied much of the theory and have a good understanding of the traditional model, and so can use that in a way that's very effective, I think. Again, California has different standards. They would like for physicians to learn some acupuncture before they practice it, and that's not as true in all of the other states. You can take little mini courses in some states and be able to practice it. So it's really, I think, very respectful in California that there is that requirement, so that they have to have some education. So what are the top, 5 or so conditions? And so I'll give my best guess in this situation and say that many people who have chronic syndrome-like things often come to acupuncture because they have had a hard time getting a specific diagnosis in any other form of medicine. Women are much higher frequency users of acupuncture than men. Many women come for menstrual irregularities. In the Bay Area, acupuncture and Chinese medicine is used very frequently for fertility. There's a lot of studies being done using acupuncture in conjunction with fertility. Pain is very high, combination of all kinds of pain, low back pain, joint pain is really a commonly used occurrence. Again, in the Bay Area, people with cancer use Chinese medicine a lot because particularly for women with breast cancer, if you're in a support group here, you hear that everybody else is using it. Across the country, people with cancer are percentage-wise higher or more frequent users of all forms of complementary medicine, including acupuncture and different herbal therapies. But I would say, so, and then the overall sense of well-being. You often will find that people who are newly insured with acupuncture in the state of California, it's more commonly true that people have access to some insurance for acupuncture, that many people will go because they feel like it helps them reduce stress, and they just feel better. It might help with their sleep a little bit. That's a great question in terms of, how do you use a diagnosis when somebody's taking many medications? Again, when people are receiving chemotherapy, they take many steroids very often. Well, it's extremely difficult to identify the true pulse of someone who's on a steroidal treatment. But even on many hypertensive medications, it's also difficult to really evaluate a pulse. So one of the things I think is important is that you are able to, beyond doing the questioning and feeling the pulse, looking at the tongue, see that person more than once. So you want to see what their pulse relativity is in terms of when they're at a weaker point or stronger point. But you should obviously know what medications they're taking and have a better understanding. And having a comprehensive intake, I think, is really important to ascertain what they're putting in their body. Beyond medication, have they had any sleep, and have they had 20 cups of coffee in a day, and things that aren't completely unheard of that people sometimes do. It's important to know that too. This fits in perfectly in terms of who uses it, to say that in '97, after so much information had been collected about how frequently people were using different forms of complementary medicine, the NIH, or National Institute of Health, pulled together a panel of people who were experts to say, from looking at the studies that exist now, what do we know it to be effective for? And that there are some things that we are clear that it can be beneficial for, some things that we need more evidence, and that we know that the adverse events are lower. And that's really important for our medical community and for our population, because it is something that's so different, and for people to feel safe in terms of using this. This was an important thing when this happened, and it literally changed how needles were labeled. Prior to this consensus panel, needles were labeled as experimental devices, and after this came out, that was taken off the box. So, and then the best evidence for pain and relief of nausea, including nausea related to chemotherapy. This is Ellen's cartoon, but I think it's really cute. This is not the kind of needles that I use. You'll be glad to know. And I think it is useful to really emphasize how safe acupuncture is, just because it's something that's so different and new. But with that said, I always say to people, you will feel the needling, and you might feel some tingling or numbness. And these are the things that people listed as being an adverse event. So a forgotten needle or dizziness. Obviously the burn injury would be from the moxibustion, not from a needle. And we had somebody visit the Osher Center not too long ago, and he was saying at the Dana-Farber Institute, they had one reported adverse event, and we were waiting with bated breath to see what he said. And he said, somebody left in a needle. And we were like, oh, we were waiting for some really big adverse event, and we were like, oh, well, we didn't feel like that was that unusual for that to happen. So with Chinese herbal therapy, I'm going to show you something about herbs, and then we're going to just do the demonstration so we can have an opportunity to talk a little bit more. But what I think is most important, let me go from the middle here to say, especially when we see so much about this in the news, the most common problem with Chinese herbal therapy that has ever arisen is about contamination and misidentification. So what I mean by that is that herbs might have sometimes drugs in them or heavy metals in them. And there is absolutely no reason for that to be true. That's about us both the providers demanding high quality standards. I personally think that the providers who prescribe Chinese herbal therapy should have the similar liability to a physician prescribing drugs, and then we would really pursue knowing what the quality of each formula is. And there are companies that absolutely use very high standards, that test every herb, that test for heavy metals, that test for all of the things that they need to be sure that it's safe. So if we separate out that issue, then looking at safety in terms of interaction and also efficacy, the risk is minimized, it's not eliminated, but minimized, because you often use many things at low doses combined, and so you would introduce them slowly. The practitioner should have very good knowledge about the medications you're taking and what they should or should not use with those medications. And again, I think that that's the practitioner's responsibility. But what is so different in terms of a model is that the full theory of Chinese herbs is that you use multiple herbs together, and how they work together is more important than taking one or two herbs at a higher dosage. I now don't use bulk herbs anymore, meaning I don't have you put together a bag of the leaves and pieces of wood for a variety of reasons. One is that it's a little bit harder to take those things when you're on chemotherapy, but more importantly is that I feel like I've been able to work with companies that make crystallized powdered herbs, that they are really testing them in a way that I feel very comfortable with the safety. So you can still individualize the formula, meaning mix together multiple herbs based on the person's condition, and then you take that. I have some powdered herbs over here so you can see. I have a lot of bulk herbs over there for people to look at, but then also the powdered herbs so you can take it and see that it's a very different way to take it. What I'd say is if you cook together bulk herbs, very often it tastes like sludge. Some people like it a lot, but that could be a good comparison. And if you take the powdered herbs, it tastes more like dirt. So dirt's a lot easier to tolerate than sludge. So you define the herbs in many different ways, and so nature and taste. What's important again is to say that you would mix many herbs together and try and match, so you wouldn't have a formula with all hot herbs and all spicy herbs. But if you were trying to warm somebody up, you might have multiple spicy and hot herbs with a few others to try and balance it. And that these herbs also then are defined as going to the channels of the body and the organs of the body. And so how those match together are very important when you're giving somebody a formula.